Hi, everyone. I am here with Dr. Stephen Lin, and I am super excited. I feel like he fills a gaping hole in the world of holistic and functional medicine, and I devoured his book, The Dental Diet, largely because I suspected that we had very similar perspectives on holistic health and have actually probably had very similar journeys in terms of what we had to unlearn in order to begin to really get outcomes, witness, full body healing, and to understand the role of nutrition in, a kind of health reclamation. So welcome, Stephen. I'm super excited to talk to you today.
Hey, Kelly, thanks so much. And wow, that's so true. What you say is that, the journey, from conventional training to kind of realizing that, wow, the body is all connected, like, teeth connected to our gut and to the brain. So that's something that, unfortunately we're not taught in conventional training, and it really is an unlearning. And so it's a journey everyone goes on. It's funny how you kind of talk to people and they're like, this is the thing that turned me. And it really has been a long path. So thank you for yours as well, because that really was on my path as well, seeing how you'd applied this to your work. It was really helpful, and I thank you a lot for that.
Absolutely. I mean, I think, and you even have this on your site, you talk about how in dentistry, of course, like in conventional allopathic medicine, no one is asking the question why, right? And so, like, I guess you might consider him some sort of a virtual mentor, like Weston Price, the I think increasingly famous pioneer of nutritional based dentistry and more. He had the same question. He's like, what is going on with my patients and their degenerative, conditions? So I think that's perhaps, where our inquiry really overlaps. I remember learning about the first inkling I had that oral health was integral to systemic health was a paper that I read years ago on how the microbiome of the placenta is actually derived, or at least our best understanding is that it's derived from the mother's oral microbiome. Like the same sort of family of bacteria that is in, the pregnant woman's mouth is seeding her placenta, and of course then contributing directly to the colonization ultimately of that fetus. And that was like a real aha, because I think even after understanding the importance of gut health and sort of the contributors to that, I think it's sort of difficult to grasp how significant oral health is. And so I'm so glad that you're on scene, sort of raising a microphone to this kind of research. I will say, because I'm, a science nut, your book is so much more, than just sort of here's why you should care about your oral health and how it impacts your body, how it could be behind so much of your, so many of your symptoms, and here's what to do about it. It's really, I think, a compendium of the incredible body of research and literature that supports this perspective. So I'd love to sort of give people a teaser, if you will, to just sort of talk about some of the, major aha moments of your research. What do you think are some of the biggest myths out there about dentistry and particularly the conventional approach?
Yeah, you really hit on some, like the exact kind of nails that I found as well. And the point was, when I kind of look back to when I was first discovering all this, I didn't understand them. And it actually went back to when I first went out and started practice, and you see all these sick people, you see all these conditions, and you have all these tools. You have all these tools to fix them. You can address them in some way or form. But then people would ask me, like, why would this happen? And why does this kid need braces and this other kid not need braces? And I'd kind of look at them and say, well, it's genetic, runs in the family, and we would I would refer them off to the orthodontist when they're 12, and that would be it. And I really kind of became a bit disillusioned with dentistry because of that, because you're always fixing things, you're always kind of putting a veneer over what we hope will look nice and project health. But what I felt that I wasn't really understanding why these conditions were happening in the first place. So I actually took some time away from dentistry, and I went on a backpack through Europe, and I was in a youth hostel and travels hostel in Turkey, and I actually came across a shared book reading shelf. I saw a book called Nutrition and Physical Degeneration by Weston A. Price, and I was like, what's this? And it said DDS on the spine, right? So even though I was trying to escape dentistry, I was like, oh, I'm going to check this out. And I picked it up, and it was this book, from this dentist that was written in the 30s, and it was like this compendium. That thing is a compendium, right? It is a journey around the world to 14 different cultures, nearly every continent on the planet, and about a dentist who thought the nutrition was at the root cause of all the conditions he was seeing. And I picked it up, I looked through it, there's 15,000 black and white photographs, it's just before World War II hit. It is mind-blowing. But my first reaction was that with my training, I thought, this can't be true. It has to be disproven, or, why haven't I ever heard of Weston A. Price before? So because I'm a skeptical person by nature, right? I like to understand the facts. And so I put it away and I disregarded it. But then I went back years later and kind of looked at it again, because it kept bugging me. It's kind of like he was tapping me on the shoulder. The universe was telling me it's time to look at this thing. And, I opened it again. And I realized I didn't understand what he was saying. And once that clicked in my mind, I was like, right, this is a journey to putting together what I can, draw from this book. And Price's work was absolutely mind-blowing. For those that, haven't read it, I really implore you just to look at it at least, and just kind of take into what this guy did in the 30s. And so he went around the world. He took anthropological records of these societies, and he earmarked exactly when the modern diet intercepts where people have been living on traditional means for thousands and thousands of years, or, that kind of range of time. And what he would do is he would give them a dental exam, he would take their food home and then measure nutritionally. So it was a study of proportion, well beyond what we've seen or anything that I'd seen in, my tertiary educations. And he was talking about human health in a way that I simply was not taught. And what we're talking about now, what we can understand now, is that it was functional medicine. It was getting to the root cause. He didn't have those words and he didn't have those definitions. But as an example, he would take these photographs of these people's faces. He said, look at these faces. And he would compare them to the people that would eat the modern diets. And so the people that ate traditional foods that their parents and grandparents and parents before them had eaten had these huge wide jaws. He would get them to open up their mouth and he would look at their dental arches. And there were no tooth decay, or nearly no tooth decay. There was no crooked teeth, so no malocclusion. So all the 32 human teeth fit, including wisdom teeth. Now, that's something that I'd never thought about, is that why, for instance, wisdom teeth impactions happen. And it's the same problem. A kid that needs their braces out when they're 10 to 12, the same problem in a young adolescent that needs their wisdom teeth out is because the jaw hasn't grown. Jaw growth is the issue. And he didn't say that specifically, but he was talking about bone building factors. He was talking about nutrients that drive growth and help the development and stability of the dental arch. And that was something I was never taught. And from there, I went on a huge journey to try and plug in, why is it that we've misunderstood this? And then kind of all these different pieces. And the Price was onto something that was vitally important, because I think that the orthodontic epidemic is the biggest problem we have on the planet now. It's the biggest health issue. Kids don't develop craniofacially, and when 32 human teeth don't fit into our jaw, there are other structures that have compensated as a result, and we understand that now. And so we've plugged in Price's picture, and it's quite frightening what's happened.
And so one of the alarms that you sound is that because of this really devolution of our species, because of this, and he called it degeneration, it's an appropriate word. One of the sort of physiologic fall guys is our airway, right? And that the impact that can have is not trivial, right? That having a compromised airway as a result of imperfectly formed jaw and dental structure can impact all areas of your life, particularly for our children, right?
Absolutely. And that was something, that was one of the big steps into a whole field of oral health that I was again not taught in conventional dentistry. And I was just at a conference this weekend talking to students, and it's like one lecture on the airway. But just to put it into context, when you have crowded upper maxillary teeth, so your upper smile, if you look at your child or yourself, then by definition, so those teeth fit into your upper jawbone, the maxilla. And so the maxilla houses your nasal airways. And so when you have a cramped high palate, when you have crooked upper teeth, that by definition means you have less airway space. And so Price didn't actually know this. Price didn't even talk about the airway. He was like, look at these amazing faces. These people are healthy. And like he would kind of, he didn't dig into the airway as such. But since then, we've had so much medicine in terms of how we understand, for instance, sleep apnea and the conditions and the sleep disorder problems. 70 million Americans now have sleep disorders. And it's all because our jaws don't grow properly and we don't have the right function to hold and breathe properly with wide patent airways. So wide open jaws that Price was recording translate to wide open airways. And when you turn around, so if you look anthropologically, there's been a lot of work done on this subsequently. A nice wide smile, 32 teeth, wisdom teeth included, with space behind the wisdom teeth, by the way. Like, so our ancestors had space behind wisdom teeth. Now, I've never seen that in a dental practice. It just doesn't happen anymore. But when you turn the skull around, so if you look at a nice wide anthropological jaw that has developed as it should, turn it around and you'll see a nice wide airway. Compare it to a jaw that's skinny, a thin V-shaped palate. You turn it around and the two airways kind of look like this. And that's by definition. And so that is so obvious, yet we've just ignored how physiologically what happens when kids don't develop wide dental arches.
And how it can obviously, as is of interest to me, it can translate to behavioral issues and chronic, fatigue that then can, be slapped as ADHD diagnosis, and it can be a domino effect where they then become medicated or, aligned academically. And it is a major root cause, of a lot of systemic issues that are misperceived. So, if I'm like anyone else, I think, okay, so this is like anatomical in nature. How could we ever do anything about this? It's one thing, the work that I do with the sort of like healing chronic diseases that have behavioral manifestations or maybe, sort of subtle physical effects, but changing anatomy and, sort of potentially reclaiming that level of health, I think to many of us seems like, how could that be possible? And also, sort of, is it possible to restructure, the oral microbiome, or is that just sort of how it is and hope for the best? Or, so I'd love to know more how you translated this like major awakening you personally have. I love that the universe like handed you this book. It's just like, you can't make that up. It's so amazing. But how you translated this awakening into, some form of, rehabilitation for people.
Yeah, there's an amazing field of functional dentistry out there now that are applying ways to approach people with, for instance, breathing issues, kids with development issues. So if for a child, we can actually change their functional habits. If we get them to breathe through their nose, put their tongue to the roof of the palate, close their lips, and stand straight and breathe nasally, their jaws will develop naturally. So there's a functional, physical component to how you work your jaws. That continues right throughout your life into adulthood. So your tongue posture, your breathing, all affects how your jaw, and also these are neurological signals you're sending to your brain as well. And the other thing that is the huge part of something that we mentioned is when you sleep. So when you sleep and relax, your airways are basically, the one thing you have to do is feed your brain oxygen. One thing. You got one job. But the problem is that when you don't have the full kind of 32 teeth, the width of that jaw, your airways, so all the muscles relax is what happens. And then what happens is your brain gets a signal that you're choking, because once once there's a certain amount of pressure, those pressure signals go straight to your brain. That sends the signal choking. Now you're told that you are in a state of survival. And so certain people will not actually be woken by this. So some people will get certain arousals that will wake them up, or they actually won't wake up at all, and they'll just have this sympathetic activation that pushes their jaw forward, so they'll actually grind their teeth. So people that grind their teeth and don't sleep very well and have this very kind of unrestful sleep, which is very, very common today. This is a subset of sleep apnea. So it's not the snoring, overweight person you consider, you know, a walking heart attack risk, basically. This is a very, very large proportion of the population, including kids that grind their teeth. You ask how many of your friends and your families, members, kids grind their teeth. A lot of them do. That's a neurological signal to open the airway, because when you push the jaw forward, you're creating that space. So it's pulling the tongue out of the oropharynx. And so that's a subset of upper airway resistance syndrome. And it's a sign that you're not sleeping well. The symptoms are so common in terms of, because when you're sympathetically woken up like this all the time, your digestive system doesn't work. So you have digestive issues. You're anxious and you're depressed. So you have, you don't sleep well, you don't function well. So many of these patients are on antidepressants. And so they would come in, they have digestive issues. They're on antidepressants. They have cold hands and feet because they have like that Raynaud's syndrome where they're sympathetic. Their body is constantly pulling in all their blood to their, as a survival response. And so it's this, and a lot of female patients suffer from this because we have this very small subset, kind of neck, jaws, and they're a dentist's nightmare because you can barely get into their mouth, right? You can't but they don't sleep well, and it's because they don't breathe well. So you can teach people to functionally do tongue exercises, reprogram yourself to breathe through the nose right throughout the night with closed lips. And we can also do therapy actually to expand the palate. So I've seen people change their palate in adults. We can grow the palate now. And the palate is kind of like the foundation of the craniofacial system. The whole face changes. So if we look at scans of people that have had palatal expansion, their eyes level out and their mandible kind of changes on both sides just with expanding the palate. But what's really interesting is the sphenoid bone also remodels as well. So the whole craniofacial system opens up and they begin to reprogram everything, and they can breathe properly, which is the most important thing.
This is so powerful. I mean, I'm realizing even as you're speaking what a critical complement, to even, my work and my approach this is, because without the awareness of the sort of mechanical rehabilitation, if you will, that is necessary to facilitate nose breathing and proper oxygenation. I mean, there are certain things that, diet can't do, certain things detox can't do, certain things that meditation can't do. They all have their place, but it's really compelling how much of an overlooked, driver of a lot of day-to-day struggle, if not more, this really is. But I know that you also care a lot about the nutritional piece. So it sounds like, and I know this is very well outlined in your book, but it sounds like, for people to get a sense of what can be done, not only for children, but for adults, it's both sort of these simple exercises to promote that kind of restructuring. And then it's working with the microbiota on the level of nutrigenomics, on the level of food as information, right?
Absolutely, yeah. So really kind of what I learned from Price's work and what the mouth and jaw teaches is that the body has a subset of nutrients. And, we can dive into so many different, minerals and different types of nutrients that the body needs. But what Price really kind of pinpointed was there were crucial nutrients your body needs in order to grow the jaws and teeth. And if your body isn't managing the skeletal system, so how it balances calcium homeostasis, that's a vital sign that everything else is going to go wrong. So everything else that we kind of look at, the gut, the digestive system, the immune system, right through the brain, it's your body has to manage its skeletal system first, and that's your bones and teeth. And so one thing that I found subsequently that really kind of really drives home what Price was talking about, is that your teeth have an inner immune system. And we were kind of taught this in dental school, actually. You can't completely write off dental school for this one, is that the cells called odontoblasts actually sit inside your the pulp of your teeth. And so they're actually fed by the osteoimmune system, so your stem cells. And what those stem cells become, they either become bone-making cells or they become immune cells. And so some of them also become your tooth, it's kind of like a SWAT team inside your teeth. And so those cells are activated and derived by signals by the fat-soluble vitamins, vitamin A, vitamin D, but also vitamin K2, which was Price's kind of missing piece. He never identified it. And this is why I think it was so misunderstood, is because we've completely missed vitamin K2 as a piece of this fat-soluble vitamin trilogy. And, there's lots of support factors for the fat-soluble vitamins, which we go through in the book. But A, D, and K2 are the key factors. And, D, because it comes from the sun, so physiologically built into our system, thousands of, hundreds of receptors on the brain even, and right throughout the body there's thousands of vitamin D receptors just waiting for it. And so when you don't get sun from an equatorial kind of latitude, then you don't get vitamin D. Or if you work indoors, if you're a health professional, if you're fully clothed outside, you may not be getting enough vitamin D, and your body is missing out on this. So the first sign is that you might get tooth decay. And so kids who get tooth decay, I always check their vitamin D levels, because it's a clear sign, and there's studies that show that blood serum levels will indicate certain risk levels of tooth decay. But so that's a sign that you need to feed yourself fat-soluble vitamins, A, D, and K2, in order to stabilize the immune system inside your teeth, your calcium homeostasis, and what grows a young child's jaw. But then all of it flows on. So the gut, the immune system, the brain, you're feeding that all subsequently. You can't just feed the mouth as on its own, right? So I just think oral health provides such an easy template, because nutrition can get so complicated. And so once we understand what the teeth need, we eat those type of foods that from traditional and well-sourced practices, and then everything else falls into place. Now, if we do have kind of other health problems, then we can kind of start to dig into other things. But I just think oral health should be the baseline, and that's how I try and work with patients, and how I try and work with other health practitioners, to really use that as the foundation, and then move forward into all these other functional approaches we can take.
It makes so much sense. I mean, it just makes a tremendous amount of sense. I mean, it also happens to be the case that, your approach and orientation, I mean, it's just so resonant with my own. So there, there's something here to the simplicity of just beginning with basics, working with your body to sort of optimize its capacity to heal and even restructure itself. So it's incredible, potential there. And then if need be, you can add on higher levels of care and need, but starting there, it makes tremendous sense. And I'm glad to hear that there is a burgeoning field of functional dentistry, because as far as I can tell, I mean, there's just way, way too few people like you, speaking in this way, talking about anything other than, fluoride. I mean, it's just an extraordinarily reductionistic, interventionist paradigm, conventional dentistry. So I'm so excited, to raise a mic to your voice. I'd love for people to know, because I have two children. I can't wait to pick your brain more about this. I mean, it's so critical, to have this in mind. So I'd love for you to talk a bit about, what you have really put your life on hold, to create in many ways for people. I mean, there's this phenomenal book, Dental Diet, which I've mentioned, that's available everywhere. You also have an online program for people who want to dive deeper, right?
Yeah, exactly. So you really kind of pinpointed the problem point in that functional dentistry is kind of a disparate space. And so there is help out there. And so what I try and do is that in my online program, the Healthy Mouth, Healthy Body program, we really try and go through the steps like alongside the dental diet is your 40-day meal plan to really get yourself back into this way of traditional eating, understanding food. You'll look at a plate and you'll understand, does this nourish my mouth and hence the body, and you can kind of move and kind of change depending on your own conditions. But so the Healthy Mouth, Healthy Body program really is for the whole family and for parents in particular to help guide their kids. Now, we can prevent orthodontic braces. It needs to be absolutely driven home to parents. And it's important that you understand the growth factors, because every day epigenetics tells us that all of these messages that go into your child's mouth, all of the environmental signals, all of their posture, breathing, how they sleep, understanding all of these signs as a parent is the most important dental check you will ever give your child. And you can guide them with very simple steps on how to get your child to breathe right. Now, kids need to be retaught, but children learn very quickly, right? And if you reprogram a kid to breathe through their nose, that is going to be life-changing, because all of the issues that flow on from mouth breathing and, for instance, having a tongue tie, you need to check your kids for tongue ties. We do that in the program. And then doing the exercise program to get them breathing and using their tongue right and getting their mouth and posture sitting properly. All of that moves us along to having a kid, for instance, that is in a much better position than having teeth extracted and braces putting on, which we're going to see as barbaric. Taking teeth out takes airway space, and we should never be taking healthy teeth out of children's mouth. And so what we go through is parents need to understand that they can look at their habits of their child, so how they eat, how they breathe, how they function, and then plugging them into a dental practitioner or an ENT specialist or a sleep physician that is going to help them get their kids' craniofacial structure and dental arch to grow properly. So we go through that in the program. It sits alongside the book, and it really is kind of a testament as to this growing field of functional dentistry.
So cool. I'm so excited that this is available. I think it's so important, and particularly for parents, because I think that we have been, we have to do our own unlearning. I mean, as somebody who wore braces, headgear, and a retainer, if I could prevent that fate for my own children, trust me, especially with the sort of do-it-yourself model, which of course is my passionate belief that that's the direction that almost all medicine has the potential to move in, is, first learn about your own physiology, about your child's physiology, monitor it, observe it, optimize it, and only after that, seek the guidance of a professional. It's so empowering. So I want to thank you so much. We will make sure that all of the links to your work and resources are below, and just keep up the amazing, amazing work.
Oh, Kelly, thank you so much. It was a pleasure. And thank you so much for your work, because really without people like yourself, this is much harder for kind of different fields and different ideas to come out of, and all of this has to come together. So I've just enjoyed this so much.
Yeah, no, I mean, we're super resonant. So it makes sense for us to sort of get on the same team and grow this message. It's really the same one of self-healing and, sort of reclaiming of vitality through lifestyle. It's where it's at. So thank you, Stephen.
Couldn't agree more.